I'm Nela, I'm the referent of sexual reproductive health, and before I was working as a referent in headquarters, I actually worked a long time as a midwife in the field. I still remember my first mission when I was sent to Sierra Leone to be in charge of a huge hospital, a referral hospital, and 5 clinics. And when they asked me in headquarters, can you manage this? Do you think you can? I said, yes, of course. I mean, I was thinking, if you think I can, I certainly can. When arriving in the field, though, I was faced with a reality that was a little bit more challenging than I had thought. I saw complications that I had never seen before. And I was not only supposed to actually give a medical answer and to treat those patients, but also to help the national staff to teach them how to deal with those situations, which is quite difficult if it's the first time you see the complications yourself. The trainings, in the beginning, I made a little bit the mistake that I thought, like, let's just call people for training at 2 o'clock in the medical office, and then nobody showed up, or they showed up like half an hour, 45 minutes late if they showed up at all. So in the end, I found out it's easier to train people when you really do the rounds with them day in, day out. It took me quite a long time to implement the MSF protocols because nobody in headquarters had actually told me, like, this is the guideline, this is like the work that you have to go on. And people actually sign a contract with MSF, which means that they agree to implement MSF protocols. So I didn't know this, so I thought that I had to reinvent the wheel and discuss everything from the base with literature reviews and so on, which didn't work, of course. Next missions it went better because I actually knew this book was existing. Then, of course, the technical work, which was quite challenging as a midwife, was not the only thing that I had to do. I also found out that I was responsible to keep the cupboard with the medication up to date, to check on expiry dates, to calculate the monthly and weekly consumptions. I also found out that if I wanted to implement new protocols, that I actually first should pass the pharmacy, because for example, when we just wanted to give out the iron tablets, which was MSF protocol and was not put in place, we talk about quite a huge amount of medication and we didn't have it in stock. So when I implemented without checking with the pharmacy if they had sufficient amount to start the implementation, we ran out very quickly and we couldn't give any iron anymore for a while until the international order arrived, which takes quite a while. For other things, I was better prepared, like making schedules for the staff. That was something that I really felt comfortable with. Data analysis, and I still love it, not only then in my first mission, but really made me see that from the data that I gathered and from the analysis of medical files and so on, we could really improve the care. In Central African Republic, I could really look at the protocols of the treatment actually that was followed for the cases of incomplete abortion. Women were left without any treatment for days. So looking into this, it really helped us to actually improve the services, to really reinforce the MSF protocols. And then based on that one, we saw a huge increase because word got out to the community. And that was very important. Quality of services, it gets out into the community, but it also works the other way around. I wasn't aware in some of my missions that actually bad care that happens, I mean midwives slapping patients, that also goes out into the community and it can have quite a huge impact. So working with the community and with the health promoters was something that I learned later on in my missions that was really important to do. Now, of course, there are some collaborations with people that are more logic, like all the medical staff, it's very logic that you work with them together. But then I also found out in my first mission, for example, that working together with a logistician is a very good idea. I found myself in a complicated delivery. We needed oxygen, and the oxygen concentrator wasn't working. So I had to call the poor guy who had never seen a delivery into the delivery room to try to repair an oxygen concentrator while we were actually in this difficult delivery. The guy was half traumatized after this, and in the end we decided it was better to set up a complete plan for the maintenance, the general maintenance of the materials, to avoid that this would happen at a critical moment. Also the collaboration with other people, like the health promoters. I found out in missions sometimes that people were with a very good intention passing messages that were or not focused on the real key messages that we wanted to pass, or were just wrong. So collaboration with the health promoters is really important. And in the end, I think as a midwife, what is expected of you is that you're really flexible, that you're creative, that you have a lot of patience. You will have to explain the same thing over and over again. It's normal. You have to accept it. I've been working as a cholera nurse at certain moments because we had a cholera outbreak that was not foreseen. I've been going on bikes into the bush to try to find internally displaced people to give them general consultations. So sometimes you will be asked to do things that are not purely linked to midwifery, but it makes everything much more challenging. So be prepared to be flexible, be prepared to be open-minded, and I think in the end you will have a very great first mission.